if you have a family member or a friend with an eating disorder, it's so important to address it, and to address it with love and kindness and compassion, no judgment, and to not focus at all on body weight or shape or appearance, because eating disorders can be life-threatening to people at any shape, with any shape, any size, any weight. So they don't discriminate, and it can happen to anybody. You know, we like to think about the stereotype. Maybe we don't like to, but we do think the stereotype of an eating disorder. A lot of people think of it as a certain kind of person, but it isn't. It can happen to any age group, any socioeconomic, any race, any gender. You know, it just does not discriminate. So we have to be open-minded when we see someone we love who's struggling with food or exercise, or you notice they start isolating themselves, start thinking about eating differently, that they actually may be really struggling. They may not look like it, or they may look like it. Either way, if you notice changes that are significant to their eating or thinking about eating and exercise, it's really important. Find a calm place, find a quiet place, make sure you're in a private place, and just tell them what you see, what you observe about their thinking, their behaviors, and kind of their approach. Things that are changing, like if in the past they would have loved to go out to dinner with you for sushi, and now they say, oh, I don't eat that, or, you know, they used to eat everything and now they're vegan, and it's not, you know, an ethical thing, or you just notice they avoid coming to meals with you at all. Point those things out, because that's like not something someone can argue with, you know, and there is a lot of ambivalence for people with eating disorders. There's two big barriers to getting help for the mind, in the mind of the person with the eating disorder. So on the one hand, they're going to be ambivalent about treatment. They may, on the one hand, want it, and also at the same time, not really want it. And then the other issue is that, you know, the treatment itself is very hard to access. And depending on the level of privilege they have, they may or may not have an easy time accessing treatment. So, you know, you could help them maybe find a provider or find some way to access care. And that would help them with the ambivalence issue and the access issue as well. And I think, you know, it's really important to keep in mind how dangerous these illnesses are. Often also people with eating disorders, one reason they're ambivalent is because they don't think of themselves as sick enough to really need treatment. But it's a life-threatening illness, an eating disorder, and a lot of medical complications can occur. And the longer somebody sits in the illness, the more entrenched their brain becomes in that kind of thinking. And so you can be a really good friend or family member by just pointing out to them what you're observing, ask them if you can help them get help, and then support them until they actually do.